premium quality pyrethrin insecticide powder.
Ameen Raa Al-Khabbyr says he's been fighting off bedbugs in his apartment for years.
I was using this powder from Canadian Tire, and it's good for 3 months.
He's a longtime tenant of this 44-unit NDG building, which offers affordable housing. One of 37 people who live here among bedbugs, mice, and cockroach infestations.
When we entered for the inspection, we realized that there's not even electricity in this apartment, but that the infestation is major. So you see the bed.
Garmier is part of a community organization that has stepped in to try to fix this.
This is unacceptable.
Besides those looking for subsidized housing, Garmier says several people who live here are diagnosed with mental health conditions. For some, this building was a way to get off the streets.
You could imagine this apartment like in a clean condition, like you have huge windows, you actually have 2 rooms. It's a perfect setting for an affordable housing for an individual living alone.
Garmier says the NDG community group stepped in January after the previous managers quit. They recently committed $35,000 to fumigate, and they're calling for help.
It's not in our budget. This is not our mandate. We're doing it because we want to save. We want to make sure those 44 people don't end up back in the street.
The nonprofit that owns the building, Logement Communautaire et Solidaire Grand, or LCSG, and the building's previous manager of several years, Société de Gestion Gerbe, each deny blame for the current state of the building. They ended their collaboration and have different views about what went wrong. LCSG says the building is run by volunteers who face a colossal task.
I can't be a management personnel, and I can't be a healthcare personnel. I can't be a social worker. It becomes a full-time job for a volunteer. See, there is something like within the system that's it's obvious to me now that it doesn't work.
The NDG Community Council says tenants' needs go beyond this current emergency. Garmier says the Regional Health Authority needs to place intervention workers in the building permanently to provide health and social services. She says some of the tenants saw some of their in-house services, like cleaning provided by the CLSC, suspended because of the infestation.
Those people need support. We need the institution. We need the system to jump in.
In a statement to CBC News, the Health Authority of West Central Montreal said it's aware of the building's situation and that some tenants are followed individually by its clinical teams. As for pauses in services, the Health Authority says in such cases, care isn't refused, but that service requests are reoriented to ensure that interventions are safe. A spokesperson added that other residents can access general health and psychosocial services through their usual points of entry, such as calling 811.
Those people are very vulnerable, so that's not acceptable.
We asked the City of Montreal for comment. They referred us to the borough. The Côte des Neiges NDG borough says it helped coordinate preparations for some of the apartments ahead of the fumigation. But as for paying for the fumigation, the borough says it can't provide any funding because the nonprofit LCSG is considered a private owner.
A private owner could raise the rent and make more money to pay whatever it is, but an OSBL cannot do that. So we're kind of in between, like this is a public service. So you could see like they've been having a mice party.
Garmier says regardless of any systemic issues, the residents need help immediately.